What if I told you that a diabetes injection is helping people lose 10, 20, and even 30 kilos without even stepping into a gym? Sounds unbelievable, but that's exactly what is happening with a drug called Ozempic.
Ozempic.
Simply Ozempic, but
The same one that has been making headlines in Hollywood and Bollywood. Celebrities like Elon Musk, Oprah Winfrey have openly credited Ozempic for their weight loss. And rumors are swirling that even some Indian stars like Karan Johar, Kapil Sharma, and many more celebrities have used similar weight loss injections under medical guidance. Hello everyone, I'm Dushyant Magu from MedSurge India, and today we are discussing a big question that's on everyone's mind. Can Ozempic really help with weight loss? Who should use it? How does it work? And is it even safe? Ozempic is the brand name for a drug called Semaglutide. It was originally developed to treat type 2 diabetes. It is taken as a weekly injection and it helps regulate blood sugar levels. But here's the twist. Doctors and patients started noticing something unexpected. People were losing weight, a lot of it. That's when it started gaining popularity, especially on social media. But this is more than just an internet trend. Ozempic mimics a natural hormone in your body called GLP-1. This hormone does three important things. Slows down your digestion so you feel full for longer. Reduce appetite. You just don't feel like eating. Lowers craving, especially for sugary or fatty foods. Think of it like turning down the volume on your hunger. That's when many people on Ozempic naturally eat less without even trying. In fact, clinical studies like these STEP trials found that people using semaglutide lost an average of 15% of their body weight in 1 year. That's a big deal, especially for people struggling with obesity. Now here's the confusion. Ozempic is not officially approved for weight loss. It is approved for diabetes. But there is a sister drug called Wegovy which contains the same ingredients, semaglutide, and it is approved for weight loss by the FDA. The difference is mainly in dosage and branding. Many doctors prescribe Ozempic off-label for weight loss because it is often more accessible. But remember, it should only be done under proper medical supervision. Ozempic is not for everyone. It is generally meant for people who have a BMI over 30 or a BMI over 27 with other health risks like high blood pressure, PCOS, or insulin resistance. This is not for someone just trying to lose 4 to 5 kilos before a wedding or a vacation. It is meant for people who have tried other weight loss methods and are facing serious health risks due to obesity. Like any drug, Ozempic has side effects, and these include nausea, vomiting, constipation, loss of appetite. Most of these get better after a few weeks, but there are also rare but serious risks like inflammation of the pancreas, gallbladder problem, and potential thyroid tumors, which is why it is not recommended for people with personal or family history of thyroid cancer. Always consult a doctor before starting this. It is not a DIY weight loss method. Now let's talk about people's experiences.
like most women, I've struggled with weight from the time I was a teenager. So GLP is something that's naturally found in the body, in the gut. We've got this class of drugs which are GLP agonists. Liraglutide, semaglutide, popularly known as Ozempic at the moment. So these are a class of drugs that were used for diabetes management. But they found that people who were using this for diabetes, that they were losing weight as well. So at higher doses, they're used for weight management. On the GLP agonists, I've also lost about 9 kilos. I've changed nothing. You know, I'll be honest, I hardly exercise. Take a daily walk with the kids and the dogs, that's about it.
Here's the part nobody talks about. When people stop Ozempic, many gain the weight back. Why? Because the appetite suppression goes away. That's why doctors emphasize combining it with dietary changes, exercise, and even therapy for emotional eating. Use Ozempic as a tool, not a permanent solution. So should you try Ozempic for weight loss? That's a bigger question. If you are clinically overweight or obese and other methods have not worked and your doctor agrees, yes, it can be effective. But if you're looking for a shortcut or cosmetic fix, this is not the way. Ozempic is powerful, but it comes with responsibility. Talk to a qualified doctor, track your health, and build healthy habits alongside. If this video helped you understand Ozempic better, please like this video and subscribe to MedSurge India for more health tips. Have you used Ozempic or are you considering it? Let us know in the comment below. Your story might help someone else. Until next time, stay informed, stay healthy.